Hi, everyone, and welcome to Wellness Unscripted. I'm Kara Merrick, a functional medicine nurse and the owner and founder of Unscripted Clinic. So today I'm thrilled to be joined by Kathrin Bodine. Kathrin is a nurse practitioner specializing in restorative reproductive medicine. She's the co-founder of Bloom Women's Health in Boise, Idaho. And today we'll be exploring holistic approaches to fertility and reproductive medicine. So welcome, Kathrin.
Hi, Kara. I'm honored to be a part of this podcast and so excited to be here.
Yay, we are too. So getting pregnant can be kind of a tricky business these days. It's not as assumed as it once was. I know that there's far more couples now that are struggling to get pregnant than there were previously. And the methods in which we approach those problems are changing and evolving, just like the rest of our medicine. So I'm hoping you could start by telling us a little bit about what restorative reproductive medicine is.
Yeah, absolutely. So restorative reproductive medicine, like the name already kind of gives away, really focusing on restoring the reproductive system. I always like to say your period is a vital sign. If things are off, if things are not working right, there's a reason, right? And I think in the past, we were very quick to be like, oh, things aren't working. Let's go IUI, IVF, or other technologies that are quite advanced, but really don't address the root cause. It kind of like bypasses or compensates or overwrites the problem, right? Let's give you a lot of medications and just induce ovulation with everything that we can. Restorative reproductive medicine is very different. It's a holistic approach and it's a root cause analysis. It's really doing a deep dive into the why. Why is your egg quality low? Why is your sperm quality low or the sperm count low? Why are your cycles irregular? What is happening in your body? What are the causes? What are the contributing factors? And then the goal is to optimize your reproductive health and your health overall.
Yeah, that's a great way to say that. We know that fertility is kind of the top of the pyramid a little bit. So I like to think of it like a stack of rocks, like you're stacking rocks one on top of each other. Your fertility is at the very top. So if your body's struggling to balance these things below it, it's not going to worry about the top of that stack. So fertility is often one of those first things to go that is, like you said, a sign that something else is happening upstream.
Right. So your fertility is really driven by your brain, by your hypothalamus a lot of the times. If your brain senses that I am too stressed, I'm undernourished, I'm overnourished, my body's not healthy, there's a lot of inflammation and something is off in my body, your brain isn't going to send those signals that you need to be have a healthy, productive ability.
Mm-hmm. So thinking more about why these things are happening, are there trends that you're seeing with clients coming in of like these things are coming up really common as to what's going on in the background?
That's a really good question. Yeah, so I think the trends are really that patients want to understand their bodies. They want to know why. They want to know, what about why am I broken, right? What is wrong? And they want the answers rather than just clearly the outcome is they want to grow their family, right?
Mm-hmm.
But more and more, I see people wanting to do that and really optimize their health and make sure that they're in a really, really great place before they go into this step. So I see people coming in younger and earlier, wanting to test their reproductive health, wanting to understand their cycles, learn about fertility, learn about hormones, the fluctuation, feel more in tune with their bodies. I see that a lot. And I also see patients that come see me first and they want to do the restorative or reproductive approach or just general. They know that they have to do IVF for some reason, whether that's a genetic abnormality or other causes where they like know that IVF is going to be the end goal for them, but they want to go into it as healthy and as restored as possible. And so that a lot of the times we'll actually combine the approaches as well.
Mm-hmm. Yeah, that's the beauty of integrative medicine and this new approach there. So it used to be that, no practitioner would even take your call if you haven't been trying for a year or more. Are you seeing changes in that? Are you seeing people coming in after just starting to try or even prior to trying?
Yes, absolutely. So the official guidelines still are if you are under 30, they want you to try, or under 35, 12 months of trying. And then over 35, they say 6 months before you have to get a fertility evaluation. And everybody over 40, the guidelines are 3 months or sooner right away.
Mhm.
Um, those are like the official guidelines. 12 months is a long time. And some people have that ability and have that time, but I really see a lot of patients coming in before they try. They know that they've been married for a while or they've been together for a while and they're thinking about it and they are going into it very prepared. And I love that. They're coming in and they want a full health evaluation or they want a semen analysis just to make sure that they do have a quality semen sample, right?
Mhm.
Or women as well. They want to just understand their cycles. They want guidance with supplements, with nutrition, with lifestyle. How can I go into this upcoming pregnancy as healthy as I can? And I love this approach. I think it's very beautiful.
Yeah, yeah, absolutely. Especially with, the prevalence of information is a blessing and a curse in that way. It's great that people can learn more about their options and about things, routes that are available to you other than just, hearing from one practitioner or one point of view. But it can also lead people to be confused because there's so much information and so much of it is conflicting. And every person's, perfect diet and lifestyle for their fertility is going to be different. They've got a different set of genetics, a different internal environment. And working with a practitioner like you, I think is such a great thing to help hone in on what's right for them to support their unique journey in fertility. So I think that's beautiful.
Yeah, I think that's a very valuable point that you bring up. As a fertility patient myself, I actually have worked with various specialists in the past. And from my own personal experience, always been given a very quick, easy diagnosis of PCOS because of irregular cycles.
Mhm.
But really, it gets so much more complex and in depth than that. And I do feel, and yes, PCOS, let's say it's very common. It is the top most common cause of irregular cycles, but
Mhm.
it's not the only cause.
Mhm.
And I think doing that deep dive root cause analysis, getting to the point of really what is happening within your own unique body is so, so important. Because after I did my own functional medicine evaluation, I found that that's not even the case for me. So for
Mhm.
years, I received treatments for PCOS when my issue was completely different.
Mhm.
And my issue was more related to hypothalamic dysfunction and like an adrenal insufficiency picture, which is completely different. And so that's why I think it's just so important to do those tests and learn your body. And like you said, practice individualized medicine. There's
Mhm.
no one size fits everyone in medicine, and especially not in fertility.
Yeah, absolutely. It's helpful to remember to move from that place of discouragement because if after you've been trying for a little while, you definitely can get discouraged. You and your partner's relationship can start to feel some tensions. And it often helps to shift the focus from like, I need to get pregnant to I wonder what's going on in there and just moving into that space of curiosity to keep digging and understanding more and more about your body and just being curious rather than, being in a fight with your body.
Absolutely.
Can you tell me a little bit more about some other common root causes that you're seeing?
Yeah, absolutely. That's a really great question. So, root causes of infertility or subfertility are very, very broad. Of course, it takes two to tango, right? There's
Mhm.
male and female factor. Um, Very commonly, we do see female factors, but also male factors. So, a lot of the times, males can struggle with low testosterone. This can be influenced by, and low testosterone also is correlated with low sperm production or just a low sperm quality, that the sperm isn't swimming appropriately. All those things we have to take into consideration when we test the male partner. So let's start out with that. male partner sperm quality very often influenced by stress, by sleep, by diet, by things such as frequent heat exposures, such as hot tubs, carrying your cell phone in your pocket is another one. Biking, somebody who is an adamant mountain biker or go classes, all that persistent testicular pressure and compression can also do some damage to negative affect your sperm quality. So those are things that we look at and that we talk about and really do a deep dive in what are your habits, what do you like to do. Also, have you ever in your life supplemented with testosterone? Because then
Hmm.
again, when you supplement testosterone, your body is recognizing, I have so much of it, I don't need to produce any. And with that, you stop producing sperm. And the longer you've supplemented, the lower the risk that we can restore your own sperm production. So
Hmm.
those are things that we address on the male side. On the female side, it gets quite a bit more in depth than that. Females, thyroid is a very big piece of that.
Hmm.
Whether your thyroid levels are too high or too low can really play a big role. Um, how and affect your fertility greatly. The most common one we already addressed is PCOS. There's this great PCOS really is an umbrella term. There's a spectrum of PCOS. There's four different types actually, and they vary in severity. The Rotterdam diagnostic criteria is really irregular cycles, some signs of excess androgen, so some signs of high testosterone in your body, whether that's hair growth on the chin or acne or a male pattern baldness, or doing an actual ultrasound and recognizing that there are multiple follicles, so a lot of little follicles that have that pearl-like structure on the ovaries. So that is one that we very commonly treat. And depending on what type of PCOS you or the patient has, also kind of guides the treatment. Sometimes weight is an issue, and reducing the weight and thereby reducing the inflammation can restore ovulation. Other times we just need to address the high testosterone levels. It's very individualized. It really depends on the patient's individual test results. The other things are structural abnormalities of the uterus. So, do you have some scarring in the fallopian tube so the egg and the sperm can't meet? Do you have adeno- uh, adenoids or fibroids or anything that's present, or a uterine septum, which is kind of like a heart shaped uterus,
Hmm.
where there's a septum, where the septum generally doesn't have a lot of blood flow. So, there, the egg can't attach, right, if it gets fertilized because it doesn't have a lot of blood flow. So those are structural abnormalities that we can evaluate with an outside referral of an HSG, which is an ultrasound with dye to where you kind of inject dye into the uterus and assess the inside of the uterus, or sometimes just a saline sonograph. All those are things that we can do to assess for those. And other common causes are endometriosis. Endometriosis really causes infertility on the basis of causing a lot of inflammation in that uterus. We know that basically what happens in endometriosis is that when you're bleeding, the fallopian tubes are open at the end, and some of that uterine lining that you're shedding during your period is leaving the fallopian tubes. For somebody who doesn't have an hyperactive immune system, that's not a concern. Somebody with autoimmunity, you create a lot of inflammation. That external tissue can grow, can create scarring, inflammation, lots of pain. So sometimes that also has to be addressed, whether that's surgical, but most of the time, really doing a surgical approach doesn't restore fertility. More so focusing on the anti inflammatory component and quieting down that chronic autoimmune response is a lot more helpful. And then last but not least is, of course, lifestyle factors, things like smoking, alcohol, um, whether your activity level plays a big role as well. Your diet, of course, is so important. And then one piece that I want to address is also chronic underlying infection. Sometimes that's another piece that often gets missed, especially in conventional medicine, where we don't test for, we like at Bloom, we do a lot of vaginal microbiome testing, where we test the microbiome and really optimize. We treat overgrowth, such opportunistic overgrowth, such as BV or mycoplasmas, those bacteria that can naturally be present and don't always cause disease, but can contribute to low grade inflammation, that then makes it a lot harder to get pregnant.
Do you also utilize like vaginal probiotics?
Yes. So, with any health optimization that involves the microbiome, whether that's vaginal microbiome or your gut health, it's always a protocol of remove what's harmful or that we don't want, and then restore what's good. So, it's always a stepwise approach where we first remove the microbes or the overgrowth that we aren't happy with or don't want to see, and then restore a healthy microbiome. So we can do that with usually a combination of oral and vaginal probiotics.
Hmm. That's interesting. I
Mhm.
have recently been reading a little bit more about that because one of my favorite probiotic companies just introduced their vaginal probiotic um, as a part of their line, and I just think it's something that can often get missed,
Mhm.
especially in fertility, but also pregnancy and delivery. That's so important be to have a healthy therapeutic microbiome that you're delivering to your baby, because that really sets up their epigenetics. It sets up their microbiome, which has so many downstream effects as to their health down the road. So yeah, love that.
That's a very valid point because transmission during a vaginal birth is
Mhm.
a real thing.
Mhm.
Uh, as the mom transmits her own gut microbiome and vaginal microbiome during a vaginal birth. And so you can thereby also have what's called vertical transmission of infection from mom to baby during that. So it's so important to optimize those things before we get pregnant if you have the opportunity to.
Mhm. Can you just briefly touch on some thyroid issues? I know that thyroid problems are also a growing concern, and they can lead to downstream fertility issues as well. Can you briefly talk about that?
Absolutely. So thyroid really affects fertility in various ways, whether we're looking at hypothyroid, so meaning a thyroid that's not functioning high enough, a hyperthyroid, which is an overactive thyroid, or if we're looking at thyroid autoimmune disease. Those are the three common things that we see that affect fertility and also affect your ability to stay pregnant. With hypothyroidism, meaning your thyroid levels are too low, often what we see is complications during pregnancy, can even lead to an increased risk of miscarriage. And if it's too low, can also stop ovulation. So that is what we see with that. In hyperthyroidism, where your thyroid is overactive, we often can run into issues such as low birth weight or preterm birth. And then thyroid autoimmunity, again, with anything that involves chronic autoimmune issues, inflammation is the underlying factor. So
Mhm.
we really have to do a deep dive in getting that inflammation down. Diet plays an important role in that. I think we'll get to that later on in our conversation, but really being very mindful of avoiding pro-inflammatory foods, keeping track of those inflammatory markers, the TPO levels of the thyroid is super important. For me personally, if I have patients with complex thyroid disease, I actually like to check their levels every 6 to 8 weeks throughout their pregnancy. I have a very narrow target range that I want them to be at to make sure that both mom and baby are safe, because later on, especially second, third trimester, the active thyroid hormone, the T3, actually doesn't cross the placenta. So having a very narrow target for T4 is extremely important.
Mhm. Yeah, and there's lots of various treatments for that as well. Um, Considering that fertility issues are pretty evenly split between men and women, it's about, a third male factors, a third female factors, and a third either both or unknown. Um, but it seems culturally that it often is the women who take the
Mhm.
brunt of the guilt with that. And
Mhm.
also, they're the first ones to look for remedies for it too. Um, I know you and Bloom Women's Health offers couples fertility care. So they get to do this as a joint effort. They both get to come in and do a full assessment and things like that. And I was hoping you could share a little bit more about that.
Yeah, absolutely. So you already kind of laid out the basis that it takes two to tango. Fertility is really a male and female factor. And unless we have a patient who has already known that their partner has had a negative workup
Hmm.
or knows that specifically they have a certain problem already, we really always recommend a couples evaluation. Usually by the time they come to see us with infertility concerns, not with preparation, but a couple that has a history of infertility, they've tried a lot of things, they've explored a lot of options. So we really want to optimize fertility for both partners and reproductive health. And so for us, the way that looks at is a full hormone evaluation of both partners, a full health history, a full reproductive history, a full lifestyle history, history of potential substance use, or like I already addressed, potential like medications or hormones that they might take or have taken in the past that are really important. And then in-depth testing for the men, that's often semen analysis. Unfortunately, outside of the IVF lab, we can't assess egg quality. So for females, we just focus more on egg quality support and regulating the cycles and optimizing the ovulatory pattern and really understanding that. And I think the beauty in that is that couples feel more connected and being in this process together and both doing the testing together rather than having one person that's kind of seeking this care out on their own, sometimes with this partner support, sometimes not. But if the partner's not an active part, they don't quite understand what the other partner's going through, whether that's all the testing, all the medications, the journey itself, just the supplements, the medicate, the side effects sometimes. I mean, it's a very exhausting process physically and emotionally. And I just see a much greater response when couples work together very, very closely
Hmm.
and support one another.
Yeah. Yeah, absolutely. We can all relate to that, I think, but it's so important that we live and eat in a way that creates the best environment for implantation and for the development of a healthy baby. So that includes the right kind of movement, like internal environment, nutrients, and emotional state. And I feel like that last emotional state one often gets pushed to the sidelines.
Mhm.
So we want to bring it back on the field because it is really, truly important for your body's ability to carry a baby. In thinking about those other factors, how do functional medicine and nutrition and lifestyle play a role in your reproductive health treatments and plan?
Yeah. Um, Functional medicine and nutrition, lifestyle, all those are very, very closely intertwined. We already kind of touched on that with negative lifestyle habits such as smoking, excessive alcohol use, processed foods, the illicit drug use, recreational drug use. Those are things that often negative affect fertility. Stress, that's a huge one. People often think that they are so healthy and they're doing all the things, but once I actually have a deep dive conversation, that they're not sleeping, their adrenal system is in constant overdrive, and their body will decide that it's not a good time to conceive.
Yeah, even beneficial types of stress, people that are, quote unquote, doing everything right. They're, hitting the gym, they're riding their bike, they're doing the sauna 4 times a week. All of those things are really great stressors for your body, but there's an asterisk there because those are also they're detrimental to this time of fertility.
Absolutely. Your body actually does not distinguish between stress of any kind, whether that's emotional stress, physical stress, psychological stress. To your body, that is all the same. Your adrenal glands don't care if it's an exercise or a divorce. They respond the same, which is hard, right? Because you're thinking you're doing all the things and being healthy, doing your cold plunges. But if you are burning the candle at both ends and also living a busy professional life and squeezing in your fertility treatments here and there, it's really harmful to your body, and your body can't be in that. You're in a constant fight or flight mode, so your body can't really relax. So for as far as the nutrition piece goes, nutrients are so important. We already touched on an anti-inflammatory diet, and then just overall gut health, probiotics, digestive enzymes when needed. It really depends on the patient's individual results where we create those protocols, but all those things are very, very, very important. I actually have a fertility diet that we kind of recommend to our patients. If you want, I'm happy to go through that.
That sounds great. Yeah, can you take us through the highlights of your fertility diet?
Yeah, absolutely. So, contrary to what a lot of people think, is that protein is actually really, really important. That's to be the priority for breakfast, lunch, and dinner.
Mhm.
But the issue is that certain proteins, a lot of really saturated fats, too much of red meat can be pro-inflammatory. So it's
Mhm.
finding that balance of maximizing your protein, but making sure we're choosing the right proteins. So
Mhm.
meat on the bone is actually one that's super, super important. Slow cooked meats, uh, bone broth, all those have a lot of zinc, iron, B vitamins, and they're rich in collagen and gelatin, and all those things are very, very important. I think what matters is the quality of the meats. Make sure that you're getting as much as you can organic, grass fed meats without antibiotics or GMOs or harmful ingredients. And that's the key. The other piece of that is that liver and organ meats are actually really good and really nutrient rich. Of course, it's not something that's commonly part of our American diet at all.
Mhm.
So what I usually recommend is just take an encapsulated version of those and that you get the nutrients that way. And
That's
those are
much
really good.
easier than a full plate of liver.
Yeah. Yeah, exactly. I mean, every once in a while somebody's like, oh, okay, I can do like a liver a week, but really most of everyone
I'm
just,
not one of those people.
yeah,
I couldn't
no,
do it. I'll
no,
take the
not at
pill.
all. But yeah, liver meat is very rich in B vitamins, folate, choline, iron, zinc, all those valuable um, micronutrients. They're all contained in liver and organ meats. And then, of course, fish and seafood. We don't eat enough of that. I always encourage about 3 servings of fatty fish a week, not more than that, because then we do get issues with high mercury exposure. And if somebody absolutely can't do fish, always recommend a supplementation with omega-3 DHA EPA supplement. And then dairy products, minimally processed dairy products, full fat is very, very important. The zero fat dairy products are extremely processed. So trying to avoid those. If you can get them from a local farmer's market, even better. And then fermented foods. I know that's like the big hype right now. You see it all over social media. Everyone is now getting into kimchi and refrigerated sauerkraut and all those things. Might not always be the most palatable food for everyone, depending on what you like, but very, very important to support your gut health. And then, of course, as many vegetables and fruits as you can get and as much of a variety as you can get.
Mhm.
Bottom line, whole foods. We want something that grows naturally, that lives naturally, that's minimally processed, and we want a lot of variety to make sure that you're getting natural vitamins and minerals from your diet.
And the fiber too. I know that fiber is extremely important. And again, one of those things that's often pushed to the sidelines or cliched, eat your fiber. Yeah, I know, but really is integral to hormone detoxification. So making sure that we're thinking about all of those, the whole chain in the hormone life cycle. So you've got to think about how hormones are created. You've got to get those nutrients in, and then you've got to make sure the pathways of transport and receptivity and detoxification are all working properly to keep those gears moving smoothly. And fiber is one of those keys that can help, grease the gears a little bit.
Absolutely. The recommendation is actually 30 grams of fiber with breakfast, which is really hard because if you think about traditional breakfast foods, it's usually like some sort of egg, bacon sandwich type food,
Yeah.
not necessarily fiber rich. I always encourage my patients if they absolutely cannot get the vegetables in first thing in the morning or can't get the fiber in, to use a low sugar, like a low sugar fiber supplement,
Mhm.
just blended in your morning drink. Doesn't taste the greatest, but it does get you, your fiber needs for first thing in the morning.
My favorite way that I've been starting to incorporate with myself and my family is to put a little extra fiber in my protein drink in the morning, because I do know how important protein is, and we need to get 30 grams of protein at least at breakfast as well.
Yeah.
And a lot of times for me, that means adding a protein drink to, the eggs and other stuff that I'm eating. So, um, and when you mix in, I've got like a fiber combo. It's like psyllium husk, acacia fiber, chia seeds, and maybe flax seeds or something. But it's just a powder. You mix it into your protein drink, and you lose it. You can't find it at all. But it gives you an extra, 8 or 9 grams of fiber just in that one hit. With the added benefit of balancing your blood sugar throughout the day too. So it's going to prevent those up and down spikes that are going to keep you satiated longer and keep you honestly more level-headed to figure out what therapeutic meal you can eat for lunch, rather than getting to a point where you're so ravenously hungry that you just, grab a donut or two from the coffee table.
Yeah. I love that recommendation. That's spot on. Exactly what I would tell my patients.
Yeah. So it's just finding, kind of these ways that work for you. I know, protein drinks in the morning might not work for everyone. It works well for most people if you find the right one. Of course, there's an infinity number of products out there. So sourcing is always really important. Thinking about the toxins in the food as well, not just the pesticides, but all the other stuff, the phthalates and parabens, all the things that work your way into your life without you even knowing. So another recommendation, just like what you were saying, is eating as close to nature as possible. So things that don't have an ingredients list, things that are grass-fed, that are eating in a natural way, not treated with a bunch of other things. There was a study, it must have been like 10 or 15 years ago now, that was saying the average baby was born with 200 toxins in their bloodstream. And that's babies that are born without even touching any of this stuff. So that just speaks volumes to what is in our bodies and what's going around in our environment that we don't even know of.
And it's probably more now, right?
I'm sure. Yeah.
15 years ago. Another piece that I wanted to talk about in the nutrition area is food intolerances.
Mhm.
So strictly for fertility, especially for recurrent pregnancy loss, making sure that we are testing for food intolerances can be an important piece to the puzzle that sometimes gets missed. And so if I have a patient where we suspect that this might be an underlying issue, we do offer food intolerance testing because it does allow us to have a clearer picture of what foods to avoid. And we know that most of the time it's usually either dairy or gluten.
Mhm.
Sometimes it's both, hopefully just one or the other. It's a little bit easier. But that's also something that we will do in a specific patient population in the picture of fertility and just optimizing your chance of a healthy pregnancy and healthy baby. It's really addressing those food intolerances and making sure that we are avoiding the food groups that somebody is very, very reactive to, really with the goal to drive down inflammation in the body overall.
Yeah. Yeah. Inflammation is one of those silent factors behind almost all health problems, fertility or otherwise. So it's important to live in accordance with an anti-inflammatory diet and lifestyle.
Yeah, agreed.
Can you tell me about some emerging trends or advancements in restorative reproductive medicine that you're really excited about and how they might improve and shape fertility care in the future?
Like we kind of touched on this a little bit in the beginning. I think the biggest trends is people wanting to know why. They're asking questions. They're not in there. We also are a lot more educated these days. People have podcasts, they have books. It's not the same as maybe 20, 25 years ago where people would just come to their OBGYN or their medical care provider and just leave the cards fully in their hands.
Mhm.
People come in very educated, very prepared. Sometimes there might be some issues of misinformation that we need to guide, but for the most part, people really do have a much better baseline knowledge about their health and bodies than they did maybe 10 years ago. And people really want answers. They want to know why, they want to understand their bodies, and they want to have some sort of say and be in charge of their care. And I love that, right? Your body, your choice, you should be able to have a say in the direction that your care is going and how aggressive you want to be.
Mhm.
And somebody might not ever want to get to IUI or IVF. It Doing the restorative approach might be the end goal for them. And if that doesn't work, that's where they draw the line, and that's okay. People, it is up to their families and the partners to really decide, how far do I want to go? What medications am I willing to try? What tests do I want to really invest in? And they want to be an active participant in their care and have a say in all the things that they're willing to do in this process.
Yes. So fertility care is, like you were saying, is not something that you just walk into a doctor's office and start taking, seriously, but it's something that you build over time. And it's the daily routines that build up to your body's ability to carry a baby and implant the egg and, be fertile. Can you tell us about your daily routines and what practices that you are really liking as a fertility patient yourself that help nurture your reproductive health?
Yeah, I would love to. For me, my biggest focus is addressing my root cause, which is really chronic stress, and hypothalamic dysfunction is really the official diagnosis, but just having what people commonly know as adrenal insufficiency or adrenal fatigue, which technically isn't a true medical diagnosis. But my focus is on managing my stress and really doing the best to promote a healthy circadian rhythm and practice stress management and relaxation techniques. So for me, what that looks like in the morning, first thing I'm very, very religious about is try to get first morning sunlight in my eyes first thing in the morning, kind of within the first hour of waking or ideally sooner. And it doesn't have to be a long time, 5 minutes, 10 minutes. I don't always have the time to sit out there for 30 minutes. Most
Mhm.
of us don't have that luxury, but just making sure I am getting outside and I have some light movement early in my day, whether that's some stretching or a short 10-minute, 15-minute walk. Um, those things are really, really important to me. I always start my day with hydration, make sure I drink a full lukewarm glass of water. I usually add lemon or apple cider vinegar to that to kind of kickstart my digestion for the day.
What
Other
about
things that I
electrolytes?
do,
Do you use electrolytes
yeah,
in the morning too? Yeah.
I do, yes, because I do exercise in the morning. So while I'm at the gym, I do drink electrolytes.
Mhm.
Yeah. And then not skipping breakfast. Believe it or not, intermittent fasting for females is actually very detrimental to your hormone health.
Mhm.
So if you're somebody who doesn't eat until late in the day, that can negatively affect your fertility. So it's really important to have a healthy breakfast. We already kind of touched on this. Make sure that we get 30 grams of protein, 30 grams of fiber. Those are really important to kickstart your metabolism for the day. And then for lunch, always have a healthy lunch. That's very important to me. Um, for me, I generally opt for something lighter, like a salad or something with like lean meats and vegetables for lunch, so I don't have that carbohydrate crash later on. And then after lunch, having a light movement again. This is something that I'm working on. This is like best case scenario, right? We all get busy, but ideally, going on a short walk after lunch really helps with balancing those blood sugars, which is
Mhm.
very important, and giving you that mental break in the middle of your day.
Yeah.
And
Yeah.
then the next thing that's super important in my evening routine that I love to do is 8 p.m. is my cutoff where my phone is actually automatically set to where the text messages and calls aren't coming through. This is my quiet time. I start putting on my blue light blocking glasses, especially if I'm going to watch TV. I'm not somebody that loves to watch TV, so a lot of the times, honestly, if it's not scorchingly hot in Idaho, I'll sit on my back patio and I'll read a book and I'll make sure I get some evening sunlight, sunset exposure, I guess I should say, and really unwind. And that's hard. I work, I have a business, I'm always on the go. People are always messaging me. So it's really hard to keep that turned off and not have that limit of saying it can wait until tomorrow. And that's something that's, I think we always are working on endlessly, but that's really, really important. And I feel like I'm getting better at it.
Yeah, that's one of those things that initially can be easier said than done, but with a little bit of discipline and some practice, it becomes way easier. It's once it becomes part of your habit after doing it for a couple weeks, then it's like a no-brainer anymore. And then you will start to see it in improvements in your sleep quality, potentially your sleep quantity, your relationship with your spouse. There's so many other effects too with just unplugging in the evening. So I love that you've created that as part of your practice too.
Yeah, you bring up a good point. Like sleep really is everything. Like if I were to tell somebody where to start with sleep.
Yes.
So, so important. This is when all your body systems reset, restore, regrow. It's just the number one thing that you can do for your health, even over exercise. That's absolutely irreplaceable.
Yeah, absolutely. Is there anything else that we didn't cover that you wish all of your clients knew about fertility support?
I think if I had to give one last piece of advice to any couple or person struggling with fertility is to try your best. And I know this is so, so hard, but try your best to let go and also find joy in the process. There is a lot of people sometimes experience a lot of time pressure, a lot of fatigue, or just being drained and exhausted. And I get it. It's so, so, so hard. And everyone around you is growing their family. And on Instagram or social media, you're constantly being targeted with things. And it's very overwhelming. And it can be a very draining and emotional process. But I think the most important thing is to not lose joy in your life and about the process and not lose balance. Yes, alcohol isn't good for you. Eating a cheeseburger necessarily isn't good for you. All those things, there's no, we need, but at the end of the day, we need to find balance in our lives. And that's immensely important and irreplaceable. We have to make time for friends and family and for that social connection. We can't 100% be on the ballpark with everything. I always tell my patients 80-20. With whatever you're doing, 80-20. Do your best to follow the guidance for exercise, for diet, for sleep, for reducing, harmful things, but also live a little. You have to enjoy life. You have to spend time with friends and family. You have to get outside and let go. And also, the number one thing is have sex for fun and not for business, right? This is where a lot of people struggle as well, that I see, where it's just like a business transaction or like, and
Yeah,
it's
it's
not
on the
fun.
schedule right here. So,
Yeah. And if for somebody who is already regular and ovulating, a lot of times I'll just tell them, stop testing with your LH strips. We know you're ovulating. Just have fun and enjoy the process, and don't become over obsessive about where you're at and what to do. And I know this is easier said than done, and harder to implement, but that's really my top recommendation.
yeah, yeah, that's great. Well, Kathrin, thank you so much for being here. Before we sign off, can you please share with our listeners how they can connect with you and learn more about your practice?
Yeah, absolutely. So we are Bloom Women's Health. We're based out of Boise, Idaho, but we are both certified, or like my Emilia and I, which is my business partner, we both are licensed across the Pacific Northwest. So that is currently Idaho, Washington, and Oregon. So we can see patients remotely as well. And we really specialize in fertility, in perimenopause, in just health optimization in general. And if you have any questions, you can find us on Instagram. Our Instagram handle is at bloom.wh for women's health. And then our website is also Bloom Women's Health in Boise, Idaho. So if you have any questions, you can always reach out. We'd love to talk with you.
Great. Well, thank you again, Kathrin, and thank you all for listening. I hope today's conversation with Kathrin has inspired you to take control of your own health journey. So remember, whether you're looking to rewrite your health script or add unscripted chapters to your journey, we're here to guide you. If this conversation sparked any questions, comments, or suggestions for future episode topics, we'd love to hear it. So drop a comment below or find us on social media at wellness.unscripted. Don't forget to subscribe for more health tips and inspiration. And if you'd like to learn more about me and my clinic, visit unscriptedclinic.com or follow us on Instagram or Facebook at Unscripted Clinic. Thanks again, everyone. See you next time.
The content provided in this podcast is for informational and educational purposes only and does not constitute medical advice. Always seek the guidance of a qualified healthcare provider with any questions you may have regarding your health or a medical condition. The hosts and guests are not responsible for any adverse effects from the use of this information.